the October 7th Select Board meeting to order. As a preliminary matter, Don Holgate, the chair of the Select Board, will confirm member access to make sure everyone who is anticipated on the agenda is present and can hear me. I will start with Select Board members. As I see you, Jason Bridges.
Hi, Don. Here.
Melissa Murphy.
Here.
Christy Ferrantella.
Here.
Matt Fee.
Here.
Thank you. Town staff members, in the order I see you, Amy Baxter.
Here.
Libby Gibson.
Present.
Brian Turbett.
Present.
Thank you. Taylor Hilst.
Present.
And Bo Grand.
Present.
Rachel Day.
Here.
Roberto Santamaria.
Both here and present.
Thank you. William Pittman.
I'm here.
Erica Mooney.
In attendance.
Rob McNeil, you're nameless. Can you hear me, Rob?
I'm here. Yeah.
I'm Jeff Carlson.
Here.
Hi, Jeff. And then I think the only other special guest we have is Gary Shaw from the hospital.
Present.
This open meeting of the Select Board is being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings. And as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting of the Select Board will feature public comment through the Zoom webinar. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that folks may be able to see you, and take care not to share the screen of your computer. Anything that you broadcast may be captured by the recordings. All of our meeting materials are posted on the town website. I will go through the agenda and introduce each speaker. Please remember to mute your phone or computer when you are not speaking. Please speak clearly to generate accurate minutes. Please wait for the chair to yield the floor to you. Please raise your hand to be recognized. All votes will be done by roll call. And I think that's it. So we'll turn to the agenda. I don't believe that there are any changes or things that are off. And we'll turn to announcements. I'll turn it over to the town manager, Libby Gibson.
Thank you. So we have what's going to be a weekly announcement for a little while for the April 5th, 2021 annual town meeting. Citizen warrant article submittals are being accepted now until 4 p.m. on November 13th. And we have set up town council times for town council consultations for citizens who wish to talk with him about potential articles. And those are on Wednesday, October 14th, 2 to 4, Thursday, October 15th, 9 to 12, 9 to 11. And those can be set up through the town manager email. And just a reminder for citizens who had articles on for the 2020 annual town meeting, who did not have them acted on, we tabled them. Your articles will automatically be placed on the 2021 annual town meeting warrant. We have a recognition of an employee who is retiring after 17 years of service at Public Works. Rob McNeil, do you want to do this, or would you like me to? I lost track.
Sure, I'm happy to.
Okay. Go for it.
Service to the town of Nantucket, from street sweeping to catch basin cleaning,
to filling in at the take it or leave it. Hartley's broad shoulders and broad smile has served as a shining example of DPW's service before self attitude that could be felt by all who worked with him. We wish Hartley a long and healthy retirement. Thank you, Hartley, for 17 years of making it happen. Thank you.
Terrific. Thank you, Rob. And thank you to Hartley. He was very accommodating, a clean team, and other times when he worked outside of the workday to come help out with picking up trash and stuff. So thank you very much to him and best wishes in his retirement. We do have one quick announcement about the census. And I don't see Martha on, so I'm just going to read this. It's an email from Martha Turk, our census coordinator. We do not have, nor can we get, a current response rate number. The Census Bureau does not provide that information anymore on a local level, and we don't know how many households, number or percentage, have been counted by census takers, so there's no way to even estimate where we are at. It's very frustrating. We are waiting for a court decision that could come at any moment, which could abruptly end the census or continue it to a different undetermined October date, because the administration has vowed to fight the ruling to reinstate the October 31st response deadline all the way to the Supreme Court if need be. So at this time, the U.S. Census response deadline has been extended back to October 31st for now, depending on the outcome of this pending court case. So that's the census update. And we may or may not have another update next week. And that is it for announcements.
Thank you. Now we will turn to the COVID-19 weekly update. Are there any opening comments or questions from the board? Excuse me. Okay, seeing none, I will turn it over to the public health director.
Thank you. So I'm going to go ahead and share my screen as usual. And I clicked on the wrong one. Of course. There we go. So with the COVID-19 report today, making sure we see everything. Okay. So as of yesterday, or this morning, sorry, we had 9,825 cases, tests through PCR, through the portico that we've been seeing. And of those, 3,312 were part of the asymptomatic cast net. We're still averaging around 25 to 50 case tests per day, not cases. I keep saying cases. 25 to 50 tests per day, and we're still doing great. So with the overview, we did have a significant spread caused by the lack of adherence to COVID. Over the last 10 days, there were 31 cases, 50 in 20, 90 in the last 30. It's really important to understand that some are symptomatic, but most are not. We did find a lot of these through contact tracing. Unfortunately, 2 cases did die in this second spread. However, as we move forward, you'll see that in comparison to last week, this positive test rate is down to green, or up to green again, where it was yellow last time. And then the number hospitalized is green now here. Unfortunately, due to the 2 deaths that we witnessed over the weekend, we are at the yellow here. So what you're seeing is in the positivity test, we want to keep that below 10%. Last week, we were seeing it in 6, almost 7%. We're down to 2.9 with a 7-day average of 2.92. And we are, with the number for those who died, trying to keep that below 5% of cases, currently at 1.94, which is very close to half, it's 2/5. So we're just trying to keep that, measure that information there. However, as far as our local COVID patients in the hospital, as of today, that was posted, thank you to the hospital for posting that. They did put that at 0 today. We still have good readiness. The capacity is up. Tracing abilities is still there. The sewer predictive index did have us showing a spike with 1 to 5 cases per day. I have not seen any of the new data. I don't know if we have this week's data yet. So moving forward, metrics, you'll see that these numbers keep increasing, and the spread keeps showing. Now 60% of our cases are below the age of 50. So you'll see that from the shift from it was before, early in the outbreak, we have now shifted to show that the younger population is actually having the biggest amount of spread with COVID on Nantucket. But it's a solid 50-50 split between male and female. With the breakdown that we've been seeing, this is now more of a homogeneous mix that we're seeing. It's all over the place. We do have a few isolated pockets of Asian Hispanics, Native Pacific Islanders, that sort of thing. But in general, it's a pretty even split, except for the 33% of it non-white Hispanic. Non-Hispanic white that we're running into here. So it's a pretty good even split. As far as points of origin go, bulk of our cases now are all Nantucketers. So I did break out non-Nantucket Massachusetts, which is this gold brownish color, which is this 4% of our cases that you'll see, but we're in good shape there. So you'll see the cumulative incidence curve that we're going to be showing. And this, now that it's gone for so long, this is showing from March to today. Since we now have that 7 months of data, I'm going to stop showing this graph, and I'm going to start showing this graph, which is the cumulative incidence as we stand over the last 30 days. This is just that 30-day spread that you'll see on the bottom, which in general only shows this section of the graph. So this that I have highlighted is what translates to this. So if you always pay attention to the X and Y axis, here in the Y axis, you'll see that it starts at 60 and we've already gone up to 150. So we have doubled cases in the last 30 days. So this is the most up-to-date sewage cases. It still says that we're in the midst of this spike. This is the same spike that we were seeing last week. This isn't means to panic. We're still in the midst of it. It goes to show that we still need to really pay attention to our COVID mitigation standards. And as far as the curves go, you'll see I keep updating these data as we go along so that I show you the most up-to-date data that I have. And you'll see starting on October 1st, we started going back down on this axis. So what does that 7-day moving average mean? So we have an R of less than 1 now, which approximately it's 0.79, which means as on a long enough time frame, as long as we keep this R down, we will no longer see cases within our susceptible population. But we have to keep vigilant until we see that go back down to 0. We had 3 days of 0 cases, which was great news. Yesterday we had 2 cases. Today we had 1. So those are the numbers we like seeing. We want to see them go down to 0 and stay at 0. And yesterday, due to the deaths that we were seeing, and we were in the midst of the big spike, the largest spike that we were having. We did implement emergency order number 13 yesterday. It came into effect today at noon, which expands the mask order island-wide with the exception of the hiking trails, and the bike paths, just simply because it's impossible to really enforce on all of that. We are limiting gatherings to 10 people, gatherings for events to 10 people, which is really important. We did exempt restaurants for normal restaurant operation. Doesn't mean move your events and your weddings and everything into a restaurant, because that's not the same thing. It's not the same, 60 people at a restaurant is not the same as 10 parties of 6, all related to the same event. It's not the same thing, and it's not a way out of it. So we did put that limit to the gatherings to 10. And then I believe The other big one is that we limited carpooling to 4 people per car, all wearing masks at the same time. With that, I'm going to move to our state numbers. So what you'll see here, what you see in front of you is actually where the state was on August 28th. I wanted to do a time progression because it's important to understand how quickly this is spreading across Massachusetts. It's not just us, which is why we're starting to see that fall spike, which is why it's really important for us to pay attention to where we are and pay attention how we're paying attention to our own mitigation standards. As of August 26th, we saw a lot of greens, only the occasional red across the state. On September 2nd, let me just do that quick change already. You'll see that most of the green had already moved on to yellow, including us. We went straight from gray to yellow. The week after, September 16th, a lot more reds. Some of the yellow states had gone back down to gray, but we still see this switch here. September 23rd, a lot more yellow across the state, and more municipalities have started to fill in. And then this is last week, where if you pay attention to the upper right side of the state, so last week, most of them were yellow. This week, a lot of them have gone red again. So the state will be releasing today's map within the next hour. So we'll see how the state is doing, the rest of the state is doing there. We are probably going to still be red, and we're going to be red for a while. We'll probably be red again next week. But we do have to pay attention to where we are. 3 zeros, 1, 2, and 1, 1 is a significant step forward to moving us back into the yellow and possibly green. And with that, I'll stop the share so that we can see each other.
Jason?
Thank you, Madam Chair. Roberto, can you just go over really quick what we have to do to get to gray or green? I think it's 2 or 3 weeks, and so that'd be helpful.
Absolutely. So what we see in the caseload, how we see it is that they do the calculation due to something called a standardized incidence ratio, where they take our caseload per day and they extrapolate it to per 100,000 of a population. They're using 11,399 as our population, which was the base from the census data, which is why it's so important to use to fill out the census. They're using that number. So even one case per day on average comes out to about a 9 per 100,000. Or just under a 9 per 100,000 based on our number. Sorry. Hairball. So from there, what we see there is if we go down to 0 cases, so 2 or 3 zeros as we go along and we stay through the ones, we can drop back down to yellow. So if we have 3 0 and 4 1s per week, that'll bring us down to yellow because that is only that 4 to 8 per 100,000. And then the more zeros we have, unfortunately, where we can't average more than 1 or 2 days of 1 or 2 cases before we hit the yellow and red again.
Can I have a follow-up?
Yes,
Madam Chair. So what can we not do because we're in red? Why? I love goals and metrics, and here's why obviously we need to get to green because we're going to be more safe. But what are the things that we're not allowed to do while we're in red?
So while we're in red, we can't move to step 2 of phase 3. That is a big hit to us, to our economy. Step 2 of phase 3 increases the size of gatherings back to the 50 and 100, 50 indoors, 100 outdoors. Instead, because we're red, we issued a local order to bring that actually from the 25 and 50 down to 10 for everyone. We're moving in the opposite direction. So we need to stay out of the red. We need to stay at least green for 3 weeks before they allow us to move to phase 3, step 2, which already puts us out into late November, maybe even December already, before we can even move to step 2. So it's a That's the big goal for us.
Melissa, I also have a question.
Sure. Thank you, Don. I just wanted to also just on that, Roberto, the goal is also for the public schools, correct? That they cannot go into the full hybrid model until we're green. Is that correct?
Correct. Correct. So us being red really pushes us into full restrictions. We did have a big, I would say, a clamp down from the state saying you're stuck at remote and only cohort A. So what we're seeing today and yesterday and over the last 5 days, including today, is the right direction, and it moves us towards going to a hybrid model. We're still on track. I believe it's for October 19th. But it's a big if. It depends on what we do how we do over the next week, at least. And yes, it's probably the single biggest factor on return to school.
Thank you. I'm sure that is a very big question on everybody's mind. I had a question on the hospitalizations because people with, the more significant illnesses are my biggest concern. Are we tracking the patients that have been transferred and if they're still hospitalized? I know that we don't have anyone here, but I don't know if maybe Gary wants to answer that or.
I'd be happy to. We are tracking them and we have had hospitalizations. And unfortunately, they have been related to the cluster that's the most recent concern. They have come in distress and declining rapidly. And as a result, the clinicians made the decision for safety and health to get those folks to a higher level of care as soon as possible. That did obviously in the past result in 2 deaths, and there are still some hospitalizations that are recovering at the Mass General and appear to be doing well. So that's good news. But it is sad. These are individuals that have come in with comorbidities. As we understand, this virus is extremely unpredictable, and we don't know how it's going to impact one person or another. But we do know statistically that the impact is a greater ratio to those that are over 60, those that are with comorbidities even younger, and then the very young. And we have seen certainly a percentage now that equates to what is predicted from CDC at the more senior level. So that's sad. But those folks that are hospitalized are doing well offshore.
Good to hear. Christy?
I know this was discussed a little bit at the Board of Health meeting yesterday, but just wondering, Gary, if you could give an update about where we are with testing. We've been surging for nearly a month now, and we've done everything from putting more restrictions on and putting more policy in place and more education, but we really haven't increased our testing capabilities yet.
Well, actually, our testing capabilities are extremely robust and we're very capable. We are testing anyone that comes and presents with a symptom. That's under the CARES program that's national. So we've been able to manage that very well. We have also been testing those that are non-symptomatic through a program that we did receive approval for and implement at the Cottage Hospital, which does require a fee, but it allows people that want to travel or go to a school or have some sort of requirement that needs to be met to come in and be tested voluntarily. And that's also done through either the hospital website or through the town website to schedule an appointment. And then we have also been testing using grant money that you, the board, have provided, which is managed by the Department of Health here locally for those individuals that we think or you think are at higher risk and need to be tested. So we are doing all of the testing that is possible. We are able to keep up with all the volumes, and we have capacity that could still be expanded. So from that perspective, we are doing well and doing everything that presents. We know that we go from an average of a few a day to over 200 when we have a concern in the public. But our goal was to create testing capability, was to test more, was to, through the education that Roberto and the board and other leaders in the community, our homeowners associations have done to educate people that if you are ill, come in and be tested. The more testing individuals that we have, the more of the infection we find, which allows us to be more focused and find it quicker, isolate it, and then hopefully eradicate it from a population that's affected. So what you're seeing for caseload is actually what I've been saying from day one is we should expect that it's here. We should behave that it's here, like it's here. We should continue to bring all that are impacted in. But the full array of testing is currently available and is widely used.
Go ahead, Christy.
Thank you. Just a follow-up question. With being red, is it possible to have anybody who wants to get tested and even removing that fee that we have at, I think it's $150, or could there be funding through the town or something just so that we could really have a wide net to test as many people as want to be tested?
And that's a great question. There are dollars still available through the town grant for testing, any that would be identified or prioritized to the public health department. The state, through its Stop the Spread testing program, has historically, and this comes through a conversation that I had with the state, with Roberto and Libby recently, where they have indicated that when a site or a part of the community has been in red for a number of weeks, that they have.
Okie dokie. So this is there we go. So what we have in front of you right now is the emergency order number 13. And then so what we have here in the first paragraph, it's expanding the mask order to the whole island. And what that does is we explicitly exempted here areas here, not included, but limited to, including but not limited to points of entry, which is the ferry and airports and everything, to marinas, parks, sidewalks, and public buildings. But we exempted beaches, bike trails, and hiking trails. Yes, and especially if you're separated from everyone by a minimum of 6 feet. These paragraph 2 is just a reiteration of the mask order from the governor. We've always had it, but now it just reiterates it and puts it back out there that all businesses shall post a sign about the mandatory mask wearing. And we do have some of those signs available as well. Number 3 is requiring face coverings on all job sites and places of employment here. So what we're looking to do is we've been seeing and receiving a lot of complaints about people not wearing masks in highly visible locations, things like certain paving operations, construction things, landscaping, groups like that. So what we're looking to do is have everyone wear the masks, mainly because you should already be wearing masks at all times, especially if you're going to be around people. But it's really easy to just, even though the governor's order says put your mask on when you're within 6 feet, it's easy to forget that. So by putting a mask order for everyone at all times, it kind of removes that forgetfulness argument there. Now it's just blanket. You should always be wearing a mask unless you're alone in your own office like this or in a work site like that. We're not going to be ticketing people if you're alone in your front, somebody who's alone in a front yard mowing a lawn. That's not the intention. That's I want to make that explicitly clear, because we did get a lot of questions about that. Paragraph 4 is asking, you should be wearing a mask whenever you're in a commercial vehicle, especially when there's more than one person. So if you're alone in a commercial vehicle, you should be okay. But if you're not alone and in a commercial vehicle, you should be wearing a mask at the whole time. Mainly because we've seen spread associated with that on island. Paragraph 5 limits the gatherings to 10 people, but it does exempt. It specifically exempts religious services, the normal operation of a restaurant, permanent entertainment venues, which includes the Dreamland, Theater Workshop, groups like that, and retail establishments and job sites. We specifically called out job sites here because we understand that in construction, you can have a team of 20 people working on a single property, and that is exempted. We do understand the importance of that. Section 6, let me see. Oh, the Section 6 specifically pulls out that certain groups have sector-specific guidances. A big example of that is actually school sports. This operation does not ban school sports. It does not limit school sports to 10 because they have a sector-specific guidance. So it was really important for us to put that out there. Number 7 says, explains that we do not expect 2-year-olds and below to be wearing masks, and people who have a medical exemption, that it's onerous and it would not be a good idea. And number 8 is a way for them that if they have any questions, it's a way to ask us, have specific ways to get in contact with the health department to request a determination of whether or not the sector-specific guidance applies. Sorry, let me roll that back. Sector-specific guidance always applies, but sometimes a gathering and an event can be considered 2 separate things. A worship service versus the potluck dinner afterwards are 2 different things. So we request that people ask us if they have any doubt, just to make sure that we don't accidentally that people don't accidentally run afoul and end up getting ticketed or cited in any way. Number 9 is just the effective date. Number 10 sets the authorized agents. Number 11 invokes Chapter 21D, which is how we issue violation notices. Number 12 is the penalties on what the costs would be using Chapter 21D. And then on the 3rd page is just the effective date.
Thank you. Are there any questions from the board or anyone from the public? Christy?
Not so much a question, more a comment or suggestion. As we're reviewing this, I know that Board of Health is going to be reviewing every month, but I was just thinking about how we've been accommodating to other industries, and if there could be some sort of log or a way to register an event if you want to have over 10 people. I'm not saying over 25, but if somebody wanted to have a funeral or something that they wanted to have more than 10 people, could there be a way to have a log where it's recorded and checked, and you guys could go and see the location if you needed to? Just with this being an indefinite order, I'm just trying to think of how we could be accommodating to some industries or events that might, or gatherings that might have to happen.
I know Amy has a way to.
Well, we already have that in place when we do event permits and things of that sort. We can certainly do that. And I think obviously those types of events are probably going to come through us too as well. So I think we spoke about that earlier today, about the process and working together with health on that information. So it's something we already have. And so we have every single event request that comes through our website and documented. So I would just suggest we probably move through that. A couple things on that I wanted to clarify too, and go over kind of the email we discussed earlier today as far as what some of the questions from that industry have been. But I think, Roberta, like if I'm correct, yesterday in the meeting, we discussed the ability to request, if a certain event is correct, but that's not or is allowable, but that's not a workaround per se. It's not if I call and get a request to have 50 people at my wedding. Correct, Roberto? I just want to make sure we go back to that, because that was looked at, I think, by some event folks as, we just need to get it approved.
Correct. That's not a variant. That's not a way to get a variance. This is just to see if whether or not something falls into this category.
Correct.
And for example, like the funeral service that was mentioned, that's actually a worship service. So we would not be who wants to have the Gestapo show up to a funeral? That's not okay. So.
And also too, along that lines, I think I wanted to make sure that we were clear as far as we obviously know, luckily it is later in the season, but there are things going on this weekend. We don't have any permanent events per se, but weddings and things of that sort. We've had some caterers contact us. And just to be clear that those gatherings that are out there that are coming up, that they have the 50 folks are outdoors, just to be clear that those need to be 10 people now. There is no, push off date. It is 10 people. So unfortunately, those things that are planned for coming up this weekend in the next week have to adhere to the 10-person limit. And we communicated that to folks, to caterers, things of that sort, licensed folks that needs to be adhered to, and including in someone's backyard.
Exactly. The intent on this is to stop the spread. Is here. We're not looking to just come down on people for no reason.
Right. So we had this back and forth, make sure that those certain things that we've gotten a lot of calls on are clear. And again, as Roberto has stated, as far as the restaurants and certain things being exempted, meaning that they are exempted for their normal daily operations, what they're licensed for as a food service, common vicular, and then they would go to sector specific guidelines. If I can segue a little bit into my section 2, as far as this phase, step 1 and step 2, that we have not moved into. So there is sector specific guidance for restaurants. However, as a high risk community, we have not moved forward. So we're still existing in the world of 6 people per table, 6 feet apart, no bar service, repurposed bar areas must be served from the dining side, that same thing. So we have not moved forward and will not move forward again until we have 3 weeks of clear reports. So this exemption is just simply for their specific daily operations. And again, as well as the theater, and then the museum, even though it's an entertainment venue, is licensed as a museum. So those standards, however, we have not moved forward into these new steps, if that makes sense for that. Am I correct, Roberta? I just want to make sure that is a correct understanding of all of that.
Absolutely. Correct.
Okay. Should I continue into my spot? I don't know if you want to step into that.
I'm fine with that if everyone else does. Okay. Thank you, Amy.
Okay. Gary?
Thank you. I jump in. I just wanted to do parting comments, and I want to talk about the goodness that's amongst us at this leadership level, and that as COVID has done its horrible deeds and killed individuals in our community, it has also torn families apart. And in this particular situation in the last few days, we had a family that was hit extremely hard with a death, with a hospitalization, and a minor being left that needed help. And I just want to thank the board members here that accepted phone calls to help coordinate a response to an individual in need from the hospital, and also do advanced planning for anyone in need in the community as we look at other clusters occurring and other situations that come forward that need some help. So thank you to this leadership team for stepping in and helping the community in so many good and positive ways. Lastly, I'll just say this is a time to get your flu vaccine. And I don't say that lightly. You do not want the flu and COVID at the same time. That combination is a hugely poor cocktail to have in your body. So I would say we're open. The drive-through is ready for you. We have vaccine capability. We've given many thousands of vaccines, and we would like to give many thousands more. My goal is to vaccinate this entire island. And whatever that number is, 15, 20, 30,000, come through the drive-through, get your flu shot, and be safer. and help us help you survive about with COVID. So thank you to the board and thank you to the community for coming in and getting your vaccines.
Thank you for all of the work you're doing. And I can attest that my family of 4 did the drive-through and it was very easy. So people should definitely go out and get their flu shot. And I was talking to people yesterday who haven't had it before, who were getting ready to go in and do it. So that was encouraging. Matt?
Yeah, I've had a few people or a couple of people call or email and complain, about the new, sort of the new rules that they're under and it's not fair and it's et cetera. And I've responded, if we want to get our kids back to school, we need to take this a lot more seriously. We need to do, what Roberto and what Gary and what everyone's asking, and we need to take it seriously. I think there's a segment that hasn't, and they haven't taken, there's been a segment that hasn't taken it seriously all summer, and that's coming home to roost. And so I think that we need to, that's what, and I've said that, and I think people, at least the people I've talked to, seem to have accepted that. The other comment is this, this hit pretty close to home, for a lot of island people, and it hit pretty close. And I think, we dodged a huge bullet, recently. We dodged a huge bullet, and what one of the people who has had COVID and was and was diagnosed was a knit shop customer with Sheila, and that that could have been. Sheila has been very careful all summer. She's been only opened for people who call ahead, and she hasn't done what the state has allowed. She's gone in for an hour or two and just by appointment only, and she washes her hands and everyone wears masks. If she had followed the protocol laid out by the state, we could have had a real issue with older individuals on this island. She's been tested and she didn't get it, and I didn't have to get tested. I almost did. I've gone and done it, and I can they've done a great job, but it's hit close to home to me, and and to a lot of the island, and we could very easily have seen another whole cluster from that one situation. And so I just think that's I think people have to be aware this is really impacting people. It's not if people are inside and there's no airflow, even if you're wearing masks, you're there long enough, you can get it. And it's an event driven disease. It's it's in the air. You've got to be very careful. So I just that I don't know. I'm probably going to get yelled at for sharing that. We're all fine, but it was a close call, and so it could happen to any one of us. It doesn't care. It doesn't care how old you are. It doesn't care what sex you are, what race. It's there, and we all need to respect it and do what these guys are asking.
Thank you. Can I turn it over to Amy now?
Thank you. I believe we took care of the first item here as far as reviewing phase 3, step 1 and step 2. So move into the second item, which is temporary outdoor dining program and extension. I think as we've discussed earlier, the past few weeks, the governor in September did issue an update to the order that originally put a deadline to remove those spaces of November 1st of this year when it was originally issued. It has since extended it, allowing these outdoor spaces. And again, this is really focused on liquor licenses, and the board is a local licensing authority as far as you can approve requests for expansion of outdoor table service for any period up to and until 60 days after the end of the state of emergency, whenever that shall be. So that's where it was left, and what the state has asked is that the local licensing authority may issue extensions automatically to all licenses, or may do so on request from individual licenses. So I submitted in your packet an update to this emergency order. Similar to Boston and other localities that did allowed for an extension into December and allowed for certain weather situations to have those spaces removed. The recommendation to the board at your discretion is to allow for the extension beyond November the 1st. First, in regards to those on private property, we have a lot of restaurants that expanded into, say, a parking lot or onto a lawn and adjacent facilities that are privately owned. I recommend that those be allowed to extend indefinitely for the duration of the health emergency as stated by the state on those properties. For the outdoor dining program on our public sidewalks and public streets, to extend the use of those spaces until December 31st, weather permitting, or until further notice or the board issues further guidance. We can do this on an individual basis. Some are planning on closing. Boarding House and the Pearl just cleared out their space today. Others are still up. So this is just to provide framework to have an allowance for that, to allow for the town to request immediate removal for weather circumstances. Number 4, it allows for a review of this again during spring renewals in March, should we look to do so after the winter months and the state of emergency is still in place. It allows us that ability, because who knows what's going to happen. So it allows us that ability and to work on that this winter as far as how we see that moving on in the future. From the fire department in regards to use of propane heaters, how to do so, how to get them inspected and approved in these outdoor spaces for safety as well. And with that, any questions as far as what we're proposing?
I don't see any hands.
Everyone's good? So this is just, and again, as someone said yesterday, a framework for all of this. We're working out details. We will update you as far as what people's plans are. We have requested closing dates and information on all restaurants, and we're starting to get those in. We have a couple that may want to stay outside, but we want to provide that opportunity as long as it's safe to do so. So that's what this update would do, and we would just ask you to vote on that approval.
Melissa?
Thank you. Don, just one quick question, Amy. I think you mentioned this a few weeks ago, but are there year-round restaurants that are looking for amendments on their license to stay, just to be seasonal, to shift that, or?
So we're starting to see some requests. Actually, I have 2 seasonals that are looking to switch to annual. And I have another seasonal that was interested in possibly doing takeout in the winter to make up for what happened. And so I'm hopefully tomorrow speaking with the ABCC, because we have so many just exceptions and things going on that the annual seasonal thing, not working.
Yeah.
At least not for now. And even in the future, Nantucket's its own little world. So we're trying to work that out, but it's on all sides. So I should have hopefully more on that.
Thank you for being such a great advocate for our business owners with the state.
Oh, thank you. Thank you.
Matt?
Yeah, I had a comment I was going to bring up under select board comment, but it seems appropriate here. One idea that a person to share with me, a couple people, is instead of doing the annual and seasonal, is just say you get a liquor license, and if you as long as you don't close more than 14 or 21 days, it's valid as soon as you close. If you want to reopen, you have to re-up it and get it all over again. Something like that might be something. We're not going to decide it tonight, but that might allow, and that would. If you have to re-up it, you've got to pay again, you've got to get inspected again. That's a pain. So it'll encourage people to stay open, but it will also encourage people not to close close when it's a little slower and open for the peaks and take it away from everyone else. So I think there's some validity to it, and it might solve the issue. Also solve the issue you're talking about.
Yeah, I agree. And we actually have started to have this conversation probably before COVID, but certainly because of it, as you can imagine, there's a lot of legal ups and downs. There's discussion of quotas, and there's discussions of of needing special legislation because, if it's different and all that. So we're starting that discussion. Hopefully with the COVID situation, it is allowing for different conversations to happen, but absolutely agree. And that's what we're trying to work out. So I will keep you updated, but we're definitely asking those questions.
How should we frame that motion?
Okay, so I believe on here, on the order here, we have, so per the order issued by Governor Baker, order number 50, we vote to approve the update to emergency order 11 to allow the extension of outdoor premises pursuant to order number 50 and local emergency order number 11.
So moved.
Thank you, Melissa. Is there a second?
Second.
All those in favor by roll call: Matt Fee,
Aye.
Christy Parentella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
John Holgate, aye. Thank you so much for all of your work on that.
Thank you.
If there aren't any public comments or other board comments, we'll move on to the Human Services update, and I'll turn it over to Taylor.
Thank you so much for having me. Erica, do you want to screen share? So thank you for having me. I was last here in early July reporting, and tonight I'm going to give an update on what some of our human services agencies, who are really our boots on the ground directly serving Nantucketers in need, have seen across the summer in July and August, and some have already provided September information as well. Additionally, agency leaders have shared with me what they believe we might see in terms of service needs in the coming fall months, and I'll talk about that at the end. So firstly, A Safe Place, which is a local agency for anyone who's not aware, who engages in domestic violence prevention and assistance in acute situations, saw slightly decreased overall numbers of clients in July and August compared to last year, though certain programming areas like trauma therapy and hotline calls were significantly increased. And they then saw a 25% increase in people served last month as compared to last year. Additionally, of note, their hotline calls were more than doubled as compared to September of last year. And this trend of kind of a decreased need in the summer, followed by starting to see an uptick, fits into what they expect to see in the coming months, which I'll discuss momentarily. Next, from Fairwinds, the counseling center, I don't have comparison data from last year, but they did share that across this past July and August, they completed a total of 151A filing, and that's the contact that they have with the Department of Children's and Family Services when there's suspected abuse or neglect. They had a total of 7 clients that they considered to be in an acute crisis, and they initiated 5 sections well-being checks. And that happens when they're working to intervene with a client who's considered to be a great risk either to themselves or others. And across those 2 months, the total clinical hours they provided was 1,289, and that includes all of their services. So outpatient mentoring, therapeutic mentoring, community support, and med management. At the hospital, in terms of insurance enrollment, they're certified application counselors who can get our community members enrolled in insurance completed 289 applications between July and September of last year, compared to 197 applications in that same time period this year. But interestingly, they had a significant increase in phone contact time with patients, which I would attribute to people having a lot more questions about their insurance this year. For social worker contact, there was not a statistical difference between the number of patients that they served last year to the past 3 months this year. Health Imperatives is an agency that offers sexual and reproductive health care, and they also administer the Special Supplemental Nutrition Program for Women, Infants, and Children, and their acronym is WIC. They continued to see some increases across the summer months, and compared to last year, in July, they had a 23% increase in WIC clients, a 51% increase in those clients in August, and a 35% increase last month. In July, they also saw a 50% increase in clients receiving their sexual and reproductive healthcare services, though they reported equal numbers in August and slightly decreased numbers in September as compared to last year. An organization that many people on Nantucket might not know about is South Coastal County's Legal Services, and that's a nonprofit that provides free civil legal services to low-income individuals, elders, and people with disabilities. They're physically located in Barnstable, but they serve Nantucket clients as well. And I think it's extremely important that people know that they have this resource. There's not really any difference between summer 2019 and summer 2020. They consistently had about 6 Nantucket clients, but please, for all of our community members to know this is available to them, and that one type of legal assistance they can offer is with housing related concerns. So information on becoming a client of theirs, if needed, is on our website. But of course, anybody can contact me directly and I'll make the referral and go over what they can help with. Elder Services has continued to demonstrate that they're serving more elders in our community, 30% more than in July of last year and 20% more than in August of last year. Partly this may be due to the fact that many seniors who typically had their elder services meal at the senior center rather than at home have transitioned over, while unfortunately we have to remain closed for in-person activities. And finally, the Nantucket Food, Fuel, and Rental Assistance Organization, whose service areas are really self-explanatory in their name, is reporting significant percentage increases, specifically in rental and utility assistance. So I have it broken down month by month in the report, but across the past 3 months in utility assistance, they provided a total of $4,296, while in 2019, they provided just $508 in that type of assistance. And then in rental assistance across the past 3 months, they have provided over $57,000 in rental aid. And in those same months last year, it was just over $26,000. So month by month on your screen, but overall, it's 117% increase. It's worth noting that these numbers are significantly smaller than in the spring, but obviously statistically, it's still quite up over last year. So I can kind of talk about what their agency leaders are expecting. No one has a crystal ball, but what they're expecting to see over the next few months. So food, fuel, and rental assistance is expecting to see an increase in assistance needs if when the service sector slows down and if businesses close for the season earlier than expected, which I think anecdotally, in my opinion, we might already be seeing. A Safe Place is definitely expecting to see an increase in office once people have more free time from work. Due to the quick shift from stay at home into work as much as you can while the work is here, many people might not have had the time to access the services that they need and kind of put it on the back burner. But once seasonal jobs are done, they're also assuming we'll see a large increase in basic client needs again, as not everyone was able to work as long as they have in years past to save for the save in the in-season for the off-season winter months. Fairwinds is expecting to see an increase in referrals based on the schools going back and crisis season coming upon us. They're expecting the referrals from the school to come in for in-home therapy, therapeutic mentoring, community support, and then outpatient referrals from self-referral, people who are referred by their primary care doctors. They very much have the capacity for an increase in referrals for clients with substance abuse or misuse, and they're actively educating other agencies that they're available and ready to see those clients. Health Imperatives is expecting really level demand for their healthcare services, but they're anticipating that the need for WIC will remain really high, as it's been demonstrated to be recently throughout the fall. For the legal services, they already tend to see an increase following the summer, and the housing eviction moratorium is currently set to expire on the 18th of this month. So they are preparing for a sharp increase in the demand for legal assistance in housing matters at this point. So with the respect to the way the town assists these agencies in helping our community members, in addition to the direct referrals for health that Health and Human Services makes, all of the information that I discussed tonight is from agencies that are current town human services grants recipients. And it's just extremely fortuitous that what wound up happening with COVID, that we already had such increased funding for this fiscal year for CRC funds. So that really couldn't have come at a better time. So thank you to CRC and FinCom and the select board and all the pieces that had to come together for that number to be so much higher this year in funding amount than it has been in last year. So I'm very grateful that worked out the way it did. Does anybody have any questions for me?
Anybody have any questions? That was so thorough.
Thank you. Thank you to the agencies.
Jason? And then
I was going to say the same thing, Don. Thank you. It was very thorough and appreciative. You know, it's good to keep this in focus of what's happening in that sector.
Absolutely. I think that sometimes anecdotal information gets thrown around, or people just aren't thinking about it and aren't sure what's really going on. And they've been so fantastic about providing their numbers and then providing the really detailed comparisons of last year, which is the only way we can even begin to say, oh, it's COVID that's causing this increase in need. Thank you, everybody.
I'll be very interested to see what this off season brings. Melissa, then Matt.
Sure, thank you. I just want to echo the thanks. And Taylor, do you know, is the emergency relief fund through the Community Foundation still set up and operating to help some of those organizations also?
Yes, and they kind of broke the types of relief that they're offering into different phases. And they are in a phase 3 where they are prepping to help agencies make up lost fundraising dollars, as a lot of these nonprofits rely really heavily on the fundraisers they can do over the summer. And though everyone did an amazing job pivoting to virtual, I don't have the numbers on that. I can't say for sure if that was as profitable as fundraisers have been in years past. In my opinion, I would guess not. So that's really wonderful. And they have been absolutely incredible in providing extra assistance to these agencies, particularly of note, Nantucket Food, Fuel, and Rental, who was also the beneficiary of Act Saves, which is tied to the Community Foundation.
No, my comments real quick. I want to thank Taylor for thanking us. It's nice to know that we all get something right once in a while. I thought that was very nice.
We got this one very right, even though we didn't know why at the time.
I realized that I skipped over our board discussion on 2021 outdoor dining. I'm sure that that's still in process a bit. I think Amy has dropped off. So maybe we just want to put that over to next week, unless anyone wants. Jason, do you want to say something?
No, I think I wanted this on the agenda, and if we don't have to get into it now, that's fine. I was talking to Matt about it earlier today, and it just feels a little, could be kind of tone deaf and insensitive to be thinking about next year and economy and businesses with everything that's happening and the amount of people that are suffering. But I do think we need to start to give, the businesses downtown, Mid-Island, an idea of, are we thinking of and did we like the outdoor seating? Or are we willing to close more streets if possible? Those type of things. I think we need to just give a basic direction. We know it's going to change 10 times from now until May 1st. But did we like what happened this year? Are we going to head in that direction so they can start making kind of their capital planning and budgeting for 2021? So if tonight's not the night, then soon.
I just want to have this conversation a little bit more with Amy, and I was moving too fast through the agenda. But I think it's very important for us to get ahead of next year, even though we don't know exactly what it's going to look like, but to keep talking about it. So we'll put it on for next week. Matt?
I think it's smart to be talking about it. Even if we, I've spoken to some people, and even if we get a vaccine in a couple months, going to need to get 10% of the population is 35 million people. It's going to take a year just to admit, or give or take, to administer 10%, and we're still only at 20 or 30%. So, so I think it's smart to be planning that we will be seeing this through next summer, and that it will be a slow, it'll slowly kind of just go away. It's not going to be a day where this, we say, oh, yeehaw, it's over. It's going to slowly disappear. But I think it would be smart to be planning for the worst and planning to be in this again next summer. So I'm with Jason. I think we should be talking about it.
Yes, absolutely. I'm sure we all agree with that. And we'll continue the discussion.
Would you mind putting it on, possibly, if I might suggest this, for the 21st? Because you have a pretty big agenda next week.
I think that's fine. I'm getting thumbs up. Public out information, town services update, anything that we need to announce?
Yep,
Yes.
We've got a few things on for this. With regard to outreach, we've been very busy with some renewed and continuing outreach efforts, including a letter to employers that we've sent out reminding them of, the COVID fatigue syndrome and the drift that Gary and Roberto spoke of, and to remind them that the sector-specific guidelines must be adhered to. We are working to refresh and reissue our messaging. We have, with Taylor's assistance, also have worked with the hospital on these care PPE packages that I think we've mentioned before. Those are still going out. The Rotary Club has obtained a lot of masks, extra masks if different groups need them, and Taylor's working with them to get those distributed. There are ongoing radio updates between Roberto and the hospital. We have, been making lots of announcements and posts on social media. Did I mention refreshed messaging? We are working on replacing and reissuing and sort of redesigning our big signs that you've seen around town. And those are in the process of getting ordered. They will be replaced. I have a surprise for hopefully sometime tomorrow, maybe, or depending on the wind. It involves our message board and where it is going to show up with a wear your mask message. You're welcome, Melissa. She has been asking me about this. And boat announcements. This has come in a few times this week. People say they aren't hearing the boat lines make mention of the mask order in Nantucket. They have both been reminded to please add that to their announcement. And we are working on getting our big sign at both boat terminals and also potentially at some other sort of entryways into and out of town. And of course, we're doing continuing education with people at job sites and other business areas about the need to adhere to the protocols. With regard to town offices, we are now at appointment only status to prevent unnecessary gatherings in closed public spaces to protect the public, especially, now. But people can certainly contact any town office and request an appointment. And to accommodate you, we will, have our own safety protocols to come into various buildings. There's sanitizing, logging people in, masks, of course, will be worn, things of that nature. And I've asked Erica to please go over, we've had some request for in-person board meetings to resume. And I think, right now, while we're in the red, is probably not a good time to start that. But we wanted to just let people know what that would take and what it takes to schedule meetings on Zoom. we've got a lot of board committee and commission meetings to schedule. They're not all totally back, I don't think, but we only have one TV channel. And so it has to revolve, a lot of this has to revolve around that if these are live meetings, and working in the ways to allow for public comment can be a bit tricky. So Erica, do you want to just do a little overview?
Sure. So we've been thinking about how in-person meetings can resume, potentially with a Zoom, with a Zoom component, because even though some board committee commission members might feel that it is time to resume in-person meetings, members of the public might not necessarily agree. And they may not feel safe coming to a location to meet with you, to be able to participate in a meeting. So how would we have it both ways? And it's tricky. I don't really know of any other community right now that has figured it out. I have spoken with a colleague in Barnstable. It's on their to-do list, but they have no plans anytime soon, because there's no need to right now with Zoom, with the Zoom capabilities. I've reached out to the state and received a letter back from the Division of Open Government. And unfortunately, you can't have a hybrid meeting which only allows some members of the public to participate and to attend in person, and then require everybody else to participate remotely. We all know there's gathering limitations. So let's just say we're not limited to 10, we're back to 25 or 50. If say 25 people show up and they're seated, but you've got then another 10 people show up and we have to say, sorry, we're full. We can't do that. And it's easy to say, well, we can have them wait, or they can just use their phone and they can be in their car or the lobby and tune in that way. Not everybody has the technology. I think we all know of at least one person who still uses a flip phone, and they just don't have that technology. And I think that we really need to be cognizant of people's feelings about protecting themselves and making sure they feel safe enough to participate in a meeting. And with the Zoom, everyone can participate that wants to, pretty much. I did speak with NCTV today, and the access issues and the technology is one thing, people being turned away in person. And then there's transparency issues. I mean, if we start turning people away and then all of a sudden they're kind of like locked out from the meeting, it's not transparent. They're being stopped. So in the meantime, I am of the feeling, and NCTV agrees, let's stay with the remote meeting formula. It's what works. It's what everybody knows. And that would be our recommendation. In terms of meetings, I don't know if you all can see this, but this is just one of the calendars that I use. And these are multiple meetings every day that I have to, we only have a few Zoom accounts. And so I'm constantly juggling them to make sure that everybody has a slot. And especially with the regulatory boards, it's been a struggle because they might have had a set schedule when they were meeting in person, because they could meet in one location or another location, and we could tape them remotely, but select board would be live or whatever. But because we only have the one station, as Libby noted, we can only film one meeting at a time. So it's really been a juggling act, and I've been trying really hard to plug everybody in, but not everybody gets the day they used to have. Not everybody gets the time they used to have. Roberto can attest to that. But I will say that they've all been really great about working with me and trying to get a slot. I mean, everybody at least has one date that is their date. Most people have more than that, but it's working, but it's a juggling act. So that's what I got. I don't know if there's any questions.
Melissa?
I don't have a question, Dawn, thank you. But Erica, thanks for that description. And for what it's worth, I really do believe that, one, I don't want to be in a situation where we limit public access to public meetings. And I feel like a hybrid model would do that. And I also think that when we have the opportunity to think about some of the advantages that technology has given our community to participate in government in ways that they've not been able to before, I think we see a lot of positives. And I'm thinking back to that joint meeting of the town and the school when I think there was over 500 people on YouTube watching that meeting. That's a level of participation that and interest in government. And clearly that was a very unique situation at a difficult time, but that's a benefit and that's an asset to our community when more people participate in government. And so I would not be in favor of doing anything that would limit that. Thanks.
I agree. I think it will be very, very challenging to do a hybrid in terms of running the meeting as well. I think that it's best to have everybody accessing the same way. And I think that we've gotten the hang of this pretty well. I mean, I'd love to be back in the community room at some point, but I'd like everyone to have access to it at that time. Does anybody else have any other comments? I guess then we move on to public comment for anything that is non-COVID related that is otherwise not on our agenda for discussion. I'm not seeing any hands raised, but if someone's hand pops up, we'll go back to it. No new business. Approval of minutes from November 20th, September 10, and September 17.
So moved.
Sorry, November 20th is not in your packet, so those have to be held over.
Thank you.
Oops, so moved for the ones that are.
September 10 and September 17.
Second.
All those in favor by roll call: Matt Fay.
Aye.
Jason Bridges.
Aye.
Melissa Murphy.
Aye.
Christy Ferrantella.
Aye.
Holgate, aye. Thank you. Approval of payroll warrants, treasury warrants, and pending contracts. Are there any questions or comments on the pending contracts?
Move approval of all.
Second.
All those in favor by roll call: Matt Fay.
Aye.
Jason Bridges.
Aye.
Melissa Murphy.
Aye.
Christy Ferrantella.
Aye.
Holgate, aye. We have one consent item, a gift acceptance for our island home. Is there a motion?
A motion to approve.
Second.
With
Second.
gratitude.
All those in favor by roll call: Matt Fay.
Aye.
Jason Bridges.
Aye.
Melissa Murphy.
Aye.
Christy Ferrantella.
Aye.
John Holgate, aye. Thank you. Citizen departmental request and committee reports. Finance Department, a request for acceptance of bequeathed funds for the James Dennis Scholarship Fund.
Thank you, Madam Chair. So the town was notified of a bequeath left by Mr. James Dennis in his last will and testament in the amount of $86,004.72, which is to be used to establish the James Dennis Scholarship Fund, which I believe the parameters of that fund were included with the AIS. It will be administered by the scholarships committee at the school. It is a town scholarship that's been set up, so we're asking for approval and acceptance so that we can establish the scholarship fund.
Is there a motion?
Motion to approve. That's so wonderful.
Second.
All those in favor by roll call: Matt Fay.
Aye.
Jason Bridges.
Aye.
Melissa Murphy.
Aye.
Christy Ferrantella.
Aye.
John Holgate, aye. Thank you. Next, we have another Finance Department request for approval of Part A, sale of 18,004,000 in general obligation bond anticipated notes for general fund, sewer, airport, and community preservation committee. And then B, if we can take them together, sale of 11,370,000 in general obligation bonds for sewer, general fund, water company, and affordable housing trust.
So,
Question.
okay, sure.
Go ahead. Sorry.
Oh, okay. I'm sorry. Thank you. So first is the sale of $18.4 million in general obligation bond anticipation notes. Mainly the largest piece is for the airport relative to the taxiway echo project. We did roll over some bans for sewer projects and town projects, as well as the affordable housing trust money that was authorized at a previous town meeting. The net interest cost is 0.2191%, which is extremely low and was a very, very positive sale. So we're asking for approval of that, as well as the second portion of the vote is for the approval of 11.3 million in general obligation bonds. We have permanently financed various projects that have been completed. The majority in the general fund is related to the remaining outstanding work that was done for the fire station, as well as money related to Nantucket Harbor, the Nantucket Harbor Schimmel Plus sewer extension, as well as in discussion with the housing director, the 2.87 million was used for purchase from the Affordable Housing Trust for the Neighborhood First program. Because those land acquisitions were completed, we have permanently borrowed that money at this time as well. When we factored in the premium that was received on the sale of the bonds, the total interest cost was 1.43%, which again was a very positive and competitive sale. So we're very pleased with the results on both of those. Erica, could you put the vote up? Do we need to do that?
Yep, there's a motion in the docket. Can we reference that that's the motion?
Yes.
If the motion could just be that you move to approve the vote that is in the select board's packet dated October 7th, 2020.
Could someone make that motion? I can't see you all, so.
I make a motion to approve.
Is there a second?
Second.
All those in favor by roll call. Matt Fee?
Quick question before we vote, just for
Yep.
Brian. Brian, you're saying it's 2%, 1%. Will you explain? Oh, hang on. You can hear me?
Yes.
All right. Can you explain what we're voting? Interest rate 5%, interest rate 3% on the back side. It's 5% at the beginning, then 3%. How does that?
So the way that works and the way that you actually award these in the general obligation bonds, which is where that is, the coupon rates range from 5 to 3 to I think 2. The way that you award though is based on the actual interest over the life of those minus the premium that is paid, which gives you what the total interest charged will be ultimately. And that is the 1.43%. So the interest cost minus the premium paid gives you the total interest cost of 1.43% on the bonds. And to one thing that I did talk to Cinder about, because I know, Matt, that you asked this question periodically, why is the majority of the bonds front loaded with 5%? And then one of the reasons that the purchasers do that is because after a certain point, the bonds become callable. And so they're trying to get their interest in upfront before we can actually call and refinance them.
Does that answer your question, Matt?
Yeah, thank you.
Go to a vote. Matt Fee?
Aye.
Jason Bridges?
Aye.
Christy Ferrantella?
Aye.
Melissa Murphy?
Aye.
Ron Holgate, aye. Thank you very much. Number 3 is request for approval of 175% area median income AMI monitoring agreement between Town of Nantucket, Richmond Great Point Development LLC, NHA Properties, DBA Housing Nantucket, and Nantucket Affordable Housing Trust Fund. I'll turn it over to Tucker.
Thank you, Madam Chair. Yes, the board will recall that when it arrived at memorandums of agreement with Richmond regarding particularly their Sandpiper 1 and Sandpiper 2 home ownership project on Old South Road, part part of that development includes home ownership opportunities, not only for the 80% AMI level, which would count on the SHI list, but also the 175% AMI level. And in those agreements, the board had obviously requested the opportunity to have those units monitored over time. It was not to be at Richmond's expense. Therefore, we have arrived in an agreement with Housing Nantucket, who obviously oversees the Covenant program, to monitor these units from the beginning and over time. There are 7 different lots in this portion of the development, which are comprised of 6 single-family homes and 1 duplex, so 8 total 175% AMI units. And the way that the program or the monitoring would work is Richmond has engaged at its own expense its own firm to conduct the qualification and awarding of these units. The firm is called SEB. So in this initial round, while it isn't entirely necessary to have Housing Nantucket do a belt and suspenders confirmation, the Affordable Housing Trust has stepped forward and said, for a modest fee, in this case $500 per household, we would pay Housing Nantucket to effectively double check or certify that, yes, in fact, they agree that these parties that SEB has qualified are indeed qualified to be purchasing these homes. And that really would be the only expense to the town or the trust in this case. Going forward, when homes are turned over, the expense would actually be borne by the seller, much as it is in other home ownership turnover arrangements. So that is the essence of what has been agreed to. All of the parties, including the trust, Richmond, and Housing Nantucket, have approved the agreement, and we are here to ask for your approval tonight.
Matt?
Yeah, so who will do upon turnover, who will do the certifying?
Housing Nantucket.
Housing Nantucket will do that. And then I'm happy with the 500, but how was that set? Just an agreement between all parties? Yeah.
Yeah, we had, talked with Housing Nantucket about what might be involved, because they're effectively taking a pre-qualified party in that case, but there's obviously some time and effort involved, and that was a figure they proposed and we felt was appropriate.
Yeah, I do too. I'm just double checking. I think it's great. I think including them is really good. Move approval.
Thank you.
Second.
Is there all those in favor by roll call? Matt Fay,
Aye.
Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
John Holgate, aye. Thank you very much. It's nice to see a new sector of homeowning opened up.
Thank you.
Next, we have real estate matters, request for approval and execution of quitclaim deed for town old parcel known as taking parcel B, Irving Street, as shown on plan of land entitled acquisition plan for portions of paper streets and Surfern Street, Irving Street, and Monomoy Avenue, dated May 6, 2015, prepared by Earl and Sullivan, voted at the 2011 annual town meeting. I'll turn it over to Ken Beaugrand.
Thank you, Madam Chair. Let me take you back. This transaction starts in 2011 at the annual town meeting, when in Article 98, the taking of this was approved, and in Article 99, the conveyance of it was approved. This was not acted on until 2015, when the select board approved the order of taking, and for some reason, we never followed through on the conveyance back to the owners of the property. As you can see from the survey, for some unknown reason, John Chagru included a large number of the so-called paper roads within the bounds of the lots that was shown on a definitive subdivision. This has been reviewed by the Real Estate Assessment Committee and by Town Council, and the conveyance does have no impact on the dimensional provisions, setbacks, ground cover, lot area of the affected property. So the purpose of this is to convey the parcel that should have been conveyed back in 2015 to the owners for $1. This is similar to the arrangement that has been previously made historically when this type of error has occurred. So it is a recommendation of Real Estate Assessment Committee, Town Council, and myself to approve the conveyance as drafted by Town Council.
Does anyone have any questions or a motion?
Move approval.
Is there a second?
Second.
All those in favor by roll call, Matt Fee,
Aye.
Christy Parentella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
John Holgate, aye. Thank you very much. Now we have public hearings. This is to consider taking of all and any portions of paper streets for public access, open space, recreational use purposes, and/or general municipal purposes, and for the purpose of conveyance of fee title or lesser interest, together with any public and private rights of passage as authorized by MGL Chapter 79, and the following town meeting votes. Portion of Weeder Avenue shown as Parcel A on plan of land entitled Roadway Acquisition Plan in Nantucket, Mass. Of a portion of Weeder, dated February 21st, 2020, prepared by Bracken Engineering, recorded with Nantucket County Registry of Deeds, Plan 2020-15, pursuant to a vote Article 98 of the 2011 Annual Town Meeting. That's Part A. Part B is portions of School Street, Laurel Street, and Shawakima Avenue, shown as easement area E1 and easement area E2 on plan of land entitled Roadway Acquisition Plan, number 3 Gladlands Avenue, Nantucket, Mass. Dated September 10, 2020, prepared by Earl & Sullivan Inc. to be continued to October 28th, 2020. Okay, so B is being continued.
That is correct, Madam Chair.
So we will make a vote at the end to definitively continue that to, or do we want to make a vote now to continue that?
Why don't we do it after?
Okay, so we'll do that after. Let's open the public hearing for Part A, and Ken.
Thank you, Madam Chair. This again starts at the 2011 annual town meeting. Again, this was part of the yard sale program that where we were taking parts of paper roads and conveying them to the abutters, and then I'm sorry, taking them from the abutters and then conveying them back at a price to be determined by the Real Estate Assessment Committee. As you can see from the plan that's shown, for some reason, the other half, the half, if you're looking at the plan, from the yellow side north, that other half of the street has already previously been conveyed to the people across the street. So the request here is to take the yellow portion and then subsequently have it reviewed by the Real Estate Assessment Committee and convey it to the owners at a price to be determined and recommended by the Real Estate Assessment Committee to the Board of Selectmen. So the vote for tonight is to, in fact, pass the order of taking with respect to the property and then proceed to the next steps with respect to reviewing and figuring out, make the presentation as to a subsequent conveyance at a price to be suggested.
Does anyone have any questions on this? This is a public as well, if anyone wishes to raise their hand and speak from the public. I'm not seeing any hands. I'm not seeing any board comments. So I'll close the public hearing on Part A and go to a vote. Is there a motion?
I'll move approval.
Is there a second?
Second.
All those in favor by roll call, Matt Fee,
Aye.
Christy Parentella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
John Holgate, aye. Thank you. And for portion B, could I have a motion to continue to October 28th? Matt,
So move to continue to October 28th.
is there a second?
Second.
All those in favor by roll call? Matt Fee,
Aye.
Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
John Holgate, aye.
And just on one comment before we get off this. Wee Weeder is interesting. If you look at a map, I supported it because we've already sold a bunch of it. But if you start looking at those streets, I know they're paper streets and I know all the rules, but you start looking at those, some of those, as we have, when they're getting that close to the beach, as we have erosion, some of those might be ones we want to hold and look at differently. And I hope that comes out of the, sort of comes out of our discussions of coastal resiliency, et cetera. Because at some point, if I know we don't have the rights in some of them, or there's the different issues that have to be dealt with, but some of those connecting streets, it would be sort of tough to have to do them again later. So just a general comment.
Matt, you've raised this before, and that is a clear item on the agenda when the REACT committee takes a look at the whole issue with respect to coastal resiliency. Has a much higher profile now. I mean, it was always on the list of things that were looked at, but it has now had a much greater profile because of what's transpired with the sea level rise.
Thank you, Ken. Next, we have a public hearing to consider the renaming of Coon Street. This was continued from September 9th, 2020, and we've had quite a bit of input on this. I'll open the public hearing. And the request, so should I talk about it? The request has been made by several residents of Coon Street. And I have had some discussions with another resident of Coon Street that was concerned about this. There were some concerns about the financial implications of a name change on things like estate planning documents and deeds and so forth, which I think has been alleviated based on an opinion from our town council. There was some additional research done by the Nantucket Historical Commission through Betsy Tyler that does go back to that talks about, among other things, the original name before it became Coon Street. There's been a number of public input that they would like to see it change, but would like to see a commemorative plaque for Captain Coon, who it was named for, and his family, or prominent whaling family. And just to throw it out there, I like the idea of going back to the original historic name, except that which was independent court, but it can no longer be court, so it would have to be another way or street or road, something along those lines. But there have been a number of suggestions. So if anyone wants to raise their hand and say what they think. This is a public hearing open to the public as well. Matt?
Yeah, a couple of things. We had a really nice letter from Levi Kuhn, which I thought, the public should know. And he talked about sort of, understanding why we may change it, and being supportive of that, but also talking, just about his family. I thought it was really nice. It was in the packet. I think the research done by Historical Commission, I thought was great and taught me things I didn't know about the Whig Party and being, mildly anti-slavery, if not outright anti-slavery. They were on Nantucket anti-slavery completely, and their in the raccoon was their animal, sort of like we have the, so their mascot, and so that's where Coon came from for that party, which I didn't realize and I thought was interesting. I agree with independent court, Don. There was also Jana Duart put out Captain Charles Way or Captain Charles Street, which would be, Mr. Coon's name, and also Grant Charles, who was a Nantucket fishermen and et cetera. And so we would be doing kind of two things. So I thought that was interesting.
Melissa?
Thank you, Don. I just want to thank everybody who took the time to reach out to us and put so much thought and care into this decision, because it's not one we should make lightly. I also really appreciated the support from Levi Kuhn. It was a really lovely email, and I thought it was nice to hear from a descendant of the family that they would support the name change. And I don't know how we can direct or ask for a plaque to be installed or where that would happen. I'm not sure how those things work, but I do think it's important that we continue to recognize the contributions of their family. I really, so one of our constituents also suggested, I think it was Little Hidden Lane, which I thought was adorable. But I do think I support Independent Lane or Independent Way. I'm not sure what's available for us there. Yeah, go ahead.
Lane is not going to work because there's an Independence Lane that runs along the side of St. Mary's.
Okay. That's right.
I mean, even though Independent is different, it's too similar.
Too similar. Okay. So what, yeah, whatever the concept is, generally in that direction, I support. And I also did really like Jana's suggestion of Captain Charles Way, because I thought that was a really nice recognition of both families who had contributions to Nantucket. And let us give both of those families a little recognition. But again, I just want to thank the community for all the correspondence we've had. It was all very thoughtful and very civil, and important to hear from everyone.
Christy?
I just wanted to echo what Melissa and Matt have already said. I know that Fran had recommended, I think, Ruth Grant Lane or Ruth Grant Street, and I think that would also be a nice way to recognize people who have lived on that street. So if we're trying to pick a name, I would also throw that in there as well.
Jason?
Yeah, I'm fine with Ruth Grant Lane. I like that. It goes along with Judith Chase Lane, Lucretia Mott Lane. It just so it flows with that well. But any kind of independent or independence, if we can figure that out, is fine. And then Captain Charles Way, I'm okay with that. You know, at our last meeting, we all decided to change it. Now we're trying to figure out what to change it to. And I want to kind of reiterate what Melissa said and others of the outpouring of research and thought that's put into this, that's come to us. Thank you.
So there are, a few names out there. I don't know if the public has any input. I don't see any hands raised. I did feel very strongly about my conversation with Penny McDonald, who's lived on the street for a very, very long time. And I've actually spoken to her about 5 times. And the name that she suggested Little Hidden Lane, but then after the research was done about Independent, I think she was very much in favor of that, and that really resonated with me. And I feel like, I mean, what better word than independent to change the street to?
I would make a motion to change the name. Again, I don't know what ending you're looking for. Is it street?
What do people think? I mean, it shouldn't be court because courts are a dead end.
Mm-hmm.
Erica?
I was going to say the same thing. And I had conversations today with both the deputy police chief regarding the E911 and the assessor. Independent would be okay, but again, it can't be lane. So it could be way or street, just not lane.
Matt?
Why don't we call it Way? Way is a smaller, it's smaller, and and I think it also describes Penny pretty well. I think that's she reminds me a lot of my mom, and she explained to me. I spoke to her a few times as well, and I'm glad to hear that she supports it. She remembers going to the laundromat. I don't know if I told this earlier, but she met my mom in the 60s at the laundromat because neither of our households had, washers or dryers. And so that was, when that was, it was kind of interesting. And I feel fortunate to have, been able to reconnect and speak to her. So if she's in favor of it, I'm in favor of it.
I really loved that story that she was hanging out with your mom at the laundromat.
So I'd make a motion to change the name to Independent Way.
Oh, actually, let me just close the public hearing. We did not have any, so, but yes, then I will take that motion. And is there a second?
Second.
All those in favor by roll call, Matt Fay,
Aye.
Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
John Holgate, aye. And if there's anything that we can do from the town level to make this change as seamless as possible with whatever needs to be filed at the registry or at the post office for these people, just, I don't want it to be cumbersome on the residents and any more than it needs to be. Melissa?
Dawn, thank you. Is there anything that we can do in terms of a recommendation on those plaques? How are recognition plaques made for people? I mostly see it through the Preservation Trust, but I'm not sure where that would be appropriate or if that's something we should talk about another time. I just don't want it to get lost.
We could talk to Mary Bergman about.
We can try to figure something out. The difficulty is where we're going to put it. It may have to go on someone's property. Ken had looked into this.
Yeah, the issue there is that the road is a private road, and so all of the neighbors abut onto the private road. So any side would need to get permission from one of the people whose property it is to put the plaque on it. I don't think that would be a problem, but I just want you to be aware that is something that would need to be negotiated with the individuals.
Erica?
I just wanted to clarify, we're talking about a plaque regarding the Coon Street name, correct?
Or the Coon family.
Not following this.
Yes.
We have
one of those residents will get back to us and volunteer a spot.
I don't know if we, to make sure that doesn't fall by the wayside, can we have someone be in charge of initiating this?
We'll figure it out.
Okay. Thank you, Libby. Sorry to add another thing to the list, but this is important. Melissa?
I hate doling work out without pitching into, so if I can help in any way, let me know.
Okay, thank you all. Appreciate it. Town managers report. Turn it over.
Okay, so thank you. First up, we had an addition to the agenda to authorize the town manager to file the applications and related documents that are noted in the agenda item. This is in connection with the third sewer enforcement project and our funding through the state revolving loan fund. This is a pretty routine authorization, but it does need to be a vote by the board.
So moved.
Is there
Second.
I'll second that.
all those in favor by roll call? Matt Fay,
Aye.
Melissa Murphy,
Aye.
Christy Ferrantella,
Aye.
Jason Bridges,
Aye.
John Holgate, aye. Thank you.
Thank you. Brian, were you going to add anything? You looked like you were going to say something.
No.
Okay, thank you. Okay, the next item is this update on the strategic plan. So the board has a retreat next week involving your annual retreat to talk about the strategic plan and update it. And I thought it'd be a good idea to give you an implementation update just before that retreat, so it's all fresh in everybody's minds. And I'm just going to take you through, this is really just more of a summary, doesn't require any action necessarily by the board. And some of the departments who are sort of project managers of these goals are going to give their summaries. So we have a sort of traffic signal, what would I call this? These circles with the colors in it that sort of, they indicate if the goal's on target, if it's in process, needs work, if it's stalled and needs attention, and so on. So with respect to the strategic plan, our first goal area is housing. And our project manager on the housing goals is Tucker Holland, our housing director. So Tucker's going to take us through each goal and just briefly summarize where we are with it and what maybe if there are next steps in the works, what they might be. But so Tucker.
Do you want me to screen share, or are you just going to review it orally?
I was just going to review it verbally, but I don't. If the board wants it to be screen shared, that's completely fine. You all tell me. Do you want it?
Fine. I think in case anybody raises their hand, I can see them all.
Okay. Tucker.
Thank you, Libby. And thank you to the board for the opportunity to give this update. As Libby mentioned, I think I'm just going to kind of hit the punchlines with respect to each of the goals, and happy to answer any questions that folks may have. The first one the board will remember is around achieving safe harbor and remaining in that for a 3-year period. As everyone is aware, we are presently in a 2-year period of safe harbor, in very large measure due to the Richmond rental project, and that will expire next June of 2021. We recently learned that the Six Fairgrounds project, which will provide 2 years of safe harbor when it receives a tax credit award, was not invited to be part of a fall mini round of tax credits, really in large part due to the appeal that only finally got resolved late this spring, or I should say late last winter. But in any event, we have known that that was a possibility, and so there are several other avenues that we have been pursuing with respect to our next period of safe harbor. So those are being evaluated really as we speak. The trust meets later this month, and we will be picking a lane in terms of our best strategy for this next period of safe harbor. And in advance, we thank the board for their continued strong support in this area. Regarding goal number 2, this is around a plan to address housing needs specifically for town employees, both year-round and seasonal. We are continuing to work toward the overall town employee housing policy. There are some complexities involved around both union and non-union issues. We are presently evaluating different sites for addressing some of these needs, and this goal continues forward. Goal number 3 is around determining in greater detail the need for housing at all affordability levels. The trust last year had engaged the Nantucket data platform, which provided further insight into this area as well. The trust is embarking on its update to the housing production plan. Our current plan was approved and runs until October of 2021. So we're in the process now of starting to update that, and further needs assessment will be part of that process. Finally, goal number 4, which the board had added last year, was around identifying incentives to encourage homeowners to use secondary dwellings as year-round rentals. I think as the board knows, this is a little bit challenging in that if we're offering a financial incentive from the trust, there needs to be a deed restriction really around the monies that would be associated And that would involve folks really, committing to a long-term commitment on renting at a income restricted level. So this is a goal that probably needs some further thinking, and perhaps it would be a combination of both carrots and sticks that would help to achieve what the board has laid out here. So with that, happy to answer any questions or turn it over to the next project manager.
Christine?
Thank you, Tucker. This isn't really a question, more of a comment, just to thank you to keep pushing through. I know there's been a lot of moving pieces throughout COVID and still focusing on keeping us in safe harbors. So I just wanted to thank you and the team and Affordable Housing Trust for staying focused on that goal and not losing sight of it.
Thank you. In looking back at this agenda item, I realized that I didn't do the greatest job of introducing it. I just want to show people our strategic plan document looks like this, and it is online. And there are 5 strategic focus areas: housing, transportation, environmental leadership, efficient town operations, and quality of life. Most of those have goals associated with them. One of them does not. That is the quality of life focus area. And that has an aspirational statement associated with it. And that is online. We're not going to get into that tonight. But moving on to the next strategic focus area is environmental leadership. And we have 2 goals associated with that. I'll say what they are, and then Rob McNeil will explain where we are with implementing them. Goal 1 is to provide data-driven recommendations on island-wide solid waste management guided by principles of sustainability. And actually, Rob, I'll do this one for you. We had a workshop 2 weeks ago about this exact goal and are working forward from that. You can add anything to that if you wish. And the second goal is to finalize, actually, Rob, you will talk about that one, I guess, to finalize an island-wide long-term water quality management plan that addresses ponds, harbors, stormwater, and wastewater with specific ways and methods to measure improvement. And Jeff Carlson's going to take us through that. That's kind of a big one. Is Jeff on? Yes, he is. Sorry. So Rob, do you want to go through goal 1 there, environmental leadership, and then you have transportation after that? But just do leadership now.
Thank you, Libby. So environmental leadership goal number 1, we did hit some of the highlights during the long-term solid waste planning effort with the board back in September the 24th. But basically we're utilizing a combination of the Mass DEP strategic plan for the next 20 years to shape what the island is going to be looking at for moving towards a zero waste type of scenario. It's been something that we've been working through for the last 3 or 4 years, and we're trying to get as much data put together to make solid recommendations to the board. Part of that includes our upcoming launch of a data platform dashboard having to do specifically with our solid waste program at the landfill. I've been working on that for about a year with our solid waste recycling coordinator, data platform, and some of our outside consultants. We have a variety of other public outreach initiatives. Probably the most public was the Waste Summit activities that spanned 6 months back in 2019, where we collected lots of public information and got the attitudes and a lot of great feedback and input from people out there that are dealing with waste stream issues, both with the drop-off and with their private haulers, and some of the other challenges that they see ahead of us, as well as some of the things that they like about our different programs. So that was really helpful. We've gotten feedback and continue to work with our regulators, both DEP and through the health department. And one of the things that we're focused on, we've met just prior to COVID regarding recommended hauler regulation changes through the health department. I know that has derailed due to COVID, but we fully expect to get that back up for discussion at our soonest convenience. We have a number of other efforts underway to try to regularize the data that's coming in from haulers through the health department and align it with the regulations, and several other studies listed here that, again, all help us provide data to make better decisions moving forward. Happy to try to answer any questions if you have them. Thank you.
Thanks, Rob.
Thanks, Rob. The next goal, as I mentioned, has to do with the water quality management plan. Jeff's going to take us through that. Jeff, you don't have to read, this is a really long one. So remember, you don't have to read the whole thing.
No, definitely. There's just a lot going on and wanted to at least get the information there for questions. So what we've been really focused on in developing this water quality management plan, hopefully be done by December of this year, or at least a good framework in place for it, was really trying to focus on finding ways to get better public outreach and to really improve the way that we're monitoring for water quality with kind of a better understanding of what's happening. So that's what we've been focused on in the last year, as far as compiling relevant bylaws and information, finding out whether other plans that we already have in place are doing and have compiled that. And in the last year, we've also been working on developing water quality metrics based upon habitat data and not just chemical analysis or other things. So we've been looking at, our bay scala populations and doing regular surveys in Nantucket Harbor. We've been looking at eelgrass and other seagrasses and their health, and really trying to look at that to find better ways to really see that our wastewater and fertilizer and stormwater management are there. And then in the table that we provided, we've also kind of addressed a little bit of what some of the remedial actions and kind of the broad brush actions are, and we'll really whittle that down as far as what's going to happen and kind of narrow those focuses into the plan. But at kind of a 10,000 foot view, that's what we're looking at in the table and the memo. And then something that we're also very excited about is hopefully in the next month or so online, we are been working with MIT Sea Grant to make all of our water quality data from about 1990 to present, all publicly accessible through a kind of a version of a GIS viewer. So you can look at the map, you can click data points, you can search whatever data you're looking for. So if you're just interested in temperature, you can look at that. If you're interested in nitrogen, you can look at that. But really to have a transparent forum that we're going to keep up and update for what's happening in our water as close to real time as we can, and supplementing that with our data that we're collecting all the time and through our SON program and our regular program that we talked about and rolling forward. We've continued to investigate the idea of an on-island water quality lab. It doesn't look like that's really economically feasible at the moment, but I think what we would like to do with that is kind of always keep investigating, keep refining that scope a little bit to see if it does become viable in the future, or if testing requirements increase, that we're not starting from scratch and that we're ready to go when it comes forward. So with that, I'm happy to take any questions. Again, we've been pretty much working on this. Roberto's been an excellent contributor in this as well, all things being considered, and our team has been a little bit stressed for time, but we're feeling good about where we are and where we're going to be headed, hopefully in the next couple months.
Great. Thank you, Jeff. Transportation is next. We have 3 goals associated with that strategic focus area. Goal 1 is to launch a downtown parking management system based on demand management principles that it achieves or is measured by 85% occupancy of public parking spaces. Goal 2 is to complete at least 1 key sidewalk route connection from Mid-Island 6 Fairgrounds Housing Project to the ferries with improved standards for accessibility. And the 3rd goal is to shift the mode of choice of commuters from driving alone to using other modes by 6%. And I'll just quickly say that that goal of 3 currently does not have a project manager because it initially was going to be the transportation planner. So we need to, that goal is basically on hold at the moment until we can get that position filled. And Chief Pittman is going to take us through a summary of where we are with goal 1. We have a project management team on that of the chief, assistant town manager Greg Tifnin, and our culture and tourism director Janice Schulte. Chief.
Good evening. I'm going to share a screen here to show you some of the progress we've made with the data collection. But overall, the project is taking a hit from the COVID crisis, obviously, particularly because while we were able to get the RFP together and hire a vendor for the management program and get it in place, we have not been able to hire a traffic coordinator or a parking coordinator or a full-time parking enforcement officer to actually do the work that needs to get done to make this 100%. Currently, we are collecting data, and I'll show you some of that data here in a second. And we are starting the process now of trying to get, hopefully by July or January 1st, getting the permitting portion of the project in place where people can start buying permits online, residential parking permits, things like that. But beyond that, we're really going to need the support of dedicated staff who have time to sit there and look at all this data and figure out what it means. And you'll know what I mean in a second. I'm going to share my screen. I think. Yes. Okay. And I'm going to show you one of the simple things that we are able to do is today we had one CSO that was downtown that was ticketing, and each of these little parking meters here represents a location where his ticket was issued.
The screen is not, we don't see your item.
You don't see it. Okay. Don't know why.
At least I don't.
How about now?
Else?
Nope.
How about now?
Yes.
Okay. So right here where these little parking meters are, you'll see are where tickets were issued today. I can, as the manager, I can come on here and I can look, and I know this green one right here is the first ticket of the day that was written, and it was written on Federal Street at 3:50 or at 9:15 this morning by Officer O'Keefe. Gives me the information I need to look up if I want to further see what it was for, whether it's overtime parking or whatever. And then they're all sequential from there, numerically. And why this is interesting is we used to not be able to tell you where the officers were at any given time of the day or where they'd been patrolling and writing tickets. Now I have, let me see if I can get this out of the way. Now we can go here. This is the same officer today, all the spots that he covered while he was on patrol today, just one officer. Now, these lines, keep in mind, these devices, these LPRs, they just do a snapshot of time. I don't know what the timing is. Maybe it's every minute it'll collect his location. So when they walk from here to here, they probably went down Broad Street and then down Federal Street and then up Chestnut Street, although the line will indicate a straight line because that's the timing between. But you can get the idea, is we can track where all they've been. So if somebody says, I didn't see an officer on India Street all day, well, today I can tell them they were absolutely correct. But if this was a summer day, that wouldn't be the case. These kinds of things. We can not only say that they were there, but what time they were there, because it's all date stamped and timed. So that's some of the data collection that we can gather, but actual real data is a little different. If you see this report right here, we can print out a report that shows the different violations that occur and where they occurred. It has a lot of information. It's got a summary of how many tickets were written for a particular violation. For instance, this was for the whole summer so far. There are 88 handicap parking violations written. The total fines levied were $5,100. And out of that 5,100, 68% of those fines have been collected. There's 13% of them were voided for whatever reason. 5% of them were forwarded to the Registry of Motor Vehicles as reports for failure to pay or other reasons. And you can see here that we had 3,357 overtime parking tickets written this summer with these devices. And right now we're looking at 59% of those tickets have been paid. So that's some of the data we can gather. It tells us each officer that actually used the machine, what tickets they wrote, how many they wrote. It tells us what street, every street a ticket was written on, like Harborview Way. There were 63 tickets written on Harborview Way. Now here it takes, this is where the parking manager is going to have to do a little work. You know, not everybody writes a street address the same way. You'll see in different places, like for instance, here, these in yellow, these are the town lots. Some officers identified it differently. Like one said town lot, Washington Street. Another said town lot, Wash. Another said town parking. So you got to kind of sort through the data to figure out where all these are. Some said Sunset Hill, others spelled it differently, Sunset Hill Lane. So, you know, there's actually, takes a little crunching to get that information. Then another report that we can get is time of day that tickets were issued. So a traffic manager can look at this and they can figure out, okay, on August 1st, these were all the tickets that were written on that day. And they can look at the time they were written and where they were written, and they can sort out, well, maybe they need to adjust their patrols, or maybe they need to change something about the parking in that location because you know, a lot of tickets are being written. So all this data can be put into Excel spreadsheets and manipulated and sorted and figured out how it relates to each other. It just takes the manpower to do it. Then we also get what's called a tow and hold report. This is a report that shows any vehicle registration that's received more than 5 tickets. As you can see here, some of these, the very first one's an Arizona plate, silver BMW that received however many tickets here over a period of 2018 and 2019. They owe us $430 at this point. These are candidates for potentially getting the barnacle, or our vendor is going after them in collection procedures to try to collect these uncollected revenues or these unpaid tickets. There are places here that people owe over thousands, multiple thousands of dollars. Right now, we're focusing on any vehicles that received a ticket in 2020 that have more than $500 in outstanding unpaid fines is what we're looking at. And from this list, which we can print out every day, we can get it. Plus, as the officers are scanning license plates, if that vehicle's on this list, it will notify them that it's on a tow and hold list, and they can look at it further and have a supervisor decide if it's something we're going to put the barnacle on as an effort to collect the fees. Other things we're working on right now are putting together some options for the board on the paid parking, especially focusing first on some of the parking lots. For instance, 2 fairgrounds, we want to figure out what we want done with that lot, and then from there we'll be able to determine how we can best move forward with either regulation changes or procedural changes or enforcement to accomplish that. And I'm putting those lists of options together, which we hope to have to this town manager within the next couple of weeks. As far as paid parking for downtown, that hasn't even been discussed down here all summer long. That really needs to wait until we have a parking manager and full-time enforcement person in place to deal with that. That's it.
Thank you, Chief. There are a couple other things that are noted in the report about paid parking. Specifically, there's the issue of Article 66 from the 2020 annual town meeting, which was voted that the select board be requested to seek prior approval of town meeting before implementing paid on-street parking. And just prior to everything getting ruined by COVID, we had a public hearing scheduled, or we were about to schedule a public hearing to amend the traffic rules and regulations to allow for a paid parking program, which is something that we need to do in order to implement it. But that was continued and we never have rescheduled it. So just noting that. Any questions about that? Cool.
Not really a question, just a quick comment. I think it's great. I think the information is amazing. I think the being able to see where the guys went and what they're doing is great. I think sort of I'm going to put a plug for a parking commission at some point, because that would help the parking coordinator and help sort of sort through these and prioritize them. It's something that I don't think that the police or the staff or, you know, or us have the time to do. And hopefully we will, when we do our strategic planning, we'll dig into this a little bit.
Okay, thank you. The next goal under transportation is the sidewalk route connection from Mid-Island to downtown. And Rob's going to give us a brief update on that one.
Thank you, Libby. The chief just mentioned the parking lot at 2FG. I'll just start by saying that we're coordinating that effort. I appreciate the chief's efforts to clear that parking lot so that DPW can get in and finish up expansion of that. And so there's lots of transportation related issues going on in that whole block, including finalizing Waite Drive, as Tucker mentioned earlier, and we're coordinating together on that. So with that, making this sidewalk connection from Mid-Island to the ferries is continuing. You know, obviously with the efforts downtown from the waterfront, will be continuing from Easy Street, turning the corner and going up Lower Broad. So far in that area, just the Straight Wharf has been completed, and a section of Lower Main and a small stretch of Easy. We still have a piece of Candle to work on, and then we'll get right into the work that we just completed at Washington, from Salem to Coffin. There's some work that's being designed currently associated with the Harbor Master building, and again, some drainage work happening that will involve some sidewalk work at 37 Washington Street. We have the recently approved Washington and Francis Union Street reconfiguration through the old NISDA property, which will involve sidewalks as well. Recently had the opportunity to update the remaining section of Salem Street following the water main break on a couple Friday nights ago. Washington Street itself is being looked at, and we are coordinating with the Coastal Resiliency folks to have discussions about the profile of Washington Street for that whole stretch, to see if we can improve that through that zone with the guidance that they've just recommended. Orange Street, besides the Consu Springs path and the connection to it on Washington Street Extension, the Orange Street bike path, there's some interim improvements being considered that have been previously mentioned, from Milestone Rotary to the Landmark House, and more permanent and long-term planning continues with our consultants looking at the entire corridor. The board is encouraged to consider Newtown Road. That was something that we have instituted speed tables on as an interim measure to control some traffic through there, recognizing it as a cut through. but obviously at the fiscal 21 annual town election, that capital request failed. So we are looking, we're obviously through the capital process now, starting that again. And we are looking for direction specifically on Newtown as to whether that goes back for the next annual town election and or town meeting. And Pleasant Street, Williams, Sparks is continuing to be under design, and that's kind of in concert with improvements being considered for the Four Corners at the roundabout near the hospital. Now that's one thing I'd add to that is the final point is the traffic counting station currently being installed at Goose Pond in Orange. And that is the island's first. It's going to be producing data. Now that the chief highlighted the data coming out of the downtown enforcement, I think it's important to highlight the different sources of data that are being created and continue to highlight that so that the board is able to make informed, data-driven decisions moving forward. That is a project in my mind that's really ripe for an overall data management plan to discuss. And I know we've initiated some discussions with IT and with data platform, and we'll continue to talk with others about how the town is going to either share its data or monetize it or do something to be able to recognize that we're creating data streams that actually have real value. And what are we going to do with that stuff? I'm happy to try to answer any questions if you have.
Libby, I think you're talking, but you're muted.
Oh, sorry. I always yell at people for that. So our second to last strategic focus area is efficient town operations. We have two goals under there. Goal 1 is develop a facilities master plan. Goal 2 is invest in technology. I'm the project manager right now for the facility master plan. And as you know, I'm trying to schedule a workshop meeting on this. Back in January, the board had agreed to have a workshop meeting about municipal facilities master plan and to look at, we were going to kind of make it interactive and look at a big map and talk about where things are now and sort of track down different alternatives about where buildings could be consolidated or moved to or built. So that is coming up, and I'm hoping to get a date for you in October or early November. The second goal is investing in technology. Karen McGonigal, our Chief Technology Officer, is a project manager for that. Karen?
Good evening, everyone. We've made a little bit of progress on goal 2, which is to provide public Wi-Fi to several of our beaches and the downtown area, and then potentially across the island, and look at improving and expanding cell service. The IT governance team met on August 6th to review potential solutions, which resulted in a presentation to the select board on August 19th, where some of these possibilities were presented. They're not recommendations. There were just points to identify what potentially could be done and to further discussion. Following that, I put together a statement of work for Plant Moran to provide a budgetary estimate to do a network design next year for capital requests. So that's why that is in there. This was about $65,000 that was submitted to the capital program for this design study. The IT governance team then met again on September 18th to review the design study, RFQ specifications, and it was determined that the scope really wasn't broad enough to cover what we needed if we're going to look at everything that's in this goal. So we took this back and decided that we were going to expand the RFQ, and I'm currently working on that to submit to state contract vendors to see what kind of costs they're going to come back with. I just lost my train. So anyway, that's going to cover the wireless network, public Wi-Fi, and associated infrastructure. On top of all of this, our town government wireless network is aging out and needs to be upgraded and replaced. So this design study is going to include the town wireless network in addition to this public Wi-Fi project. It's a combination at the moment. The more I look at it, I may split it into two pieces, but right now it's a single RFQ with two separate sections involved. The IT governance team discussed the scope of the project and determined that we really need to come up with a master plan to cover all of these items in the goal to really do it right. Rather than try to do this piecemeal, do one section at a time, just do downtown, just do the town network, come up with a master plan, and then if we need to scale back, we can. And that's what we're working on right now. We don't have our next meeting scheduled. I anticipate that will be sometime in November or early December. And we're also building an inventory of town-owned buildings and facilities. And Nathan has been doing GIS maps for me. And I'm sharing that data with Mark Voigt at DPW so that we have a consistent list of what network capabilities are currently available at the town buildings and what we may consider expanding to. And that's really where we're at right now. Any questions?
Thank you very much, Karen. I know that you've been working really hard on this. Our last focus area is quality of life, and there are no goals specifically associated with that. We have discussed at the staff level an RFP to conduct a community needs survey. That's been put on hold due to COVID. And the Park and Rec master plan was kind of associated with quality of life goal, and that was discussed at the board September 9th meeting. So that, I think, is it.
Thank you. That was great. We'll reconvene on Tuesday for strategic planning. And we'll move on to select board reports and comments. We just have a very quick update on the diversity, equity, and inclusion initiatives. We're still very much deep in the hiring process, interviewing process, and that will be moving forward. As soon as we have more, we will update. We'll probably be moving this agenda item to a once a month to get more of an update at once. But if we do a hiring before the next time we would slate it for, then we'll put it onto the agenda. And are there committee reports? Christy?
Thank you. I just wanted to thank town admin and everybody for that strategic plan update. It was really good to review before Tuesday's meeting with all of us. Affordable Housing Trust Fund kicked off a meeting today with the housing production plan that Tucker talked about a little bit earlier. So we're in the process of updating that. I think it's every 4 years. And so we'll be working with the community and a lot of housing stakeholders to update that plan. And that was about it. NPDC didn't meet this month. And I think Jason's the Capcom select board rep, but I'm on it for NPDC. And we've just been reviewing the different requests. A lot of them are rollovers from last year since everything got tabled due to COVID. So there hasn't been too many new requests that will be coming before the select board this year. The last thing I just forgot to mention during COVID, a lot of the questions I've received this past week and last week with the surge is how businesses know when to test their employees or if they can restrict them from coming to work, or kind of what are the rules around that of if they travel out of state or things like that. So I know that we have an FAQ on the town website, and when Libby was going over all of the public relations information, I just think that might be a good FAQ is when to test, how to test. I know the hospital has a ton of resources, but if there's a go-to spot for businesses, that I think that would be helpful. Thank you.
Thanks, Christy. Matt?
We received a letter from the non-voting taxpayers, and it was talking about noise issues that they found very troubling this summer. And so I think that's something we should discuss, maybe at the quality of life for strategic planning, or maybe at a meeting. I know it's a third rail. People think that they should be able to, work. And I know it's been an issue, but really there has to be a balance. So we've got to figure out if we can figure out what that is. BPAC met today, and we should be seeing, they voted to request a review of the Washington and Francis intersection. There was another option that they were talking about that was presented. So I think we should expect to see that. There was also a discussion of sort of state law, the nuisance stop signs on the bike paths. Those, Ian is tracking those, and those have increased even on private roads. And so, I think they're going to be coming to us with that information. Let me see. There's been a work group working with SBPF doing, it's sort of a settlement work group trying to see if there's a way that, sort of how I look at it is people ask, what are we doing? We're trying to find a path to explore and address the concerns of the town, the Concom, the public, and SBPF. Is there a way to do that and avoid the uncertainty of litigation and some of the issues that we're dealing with? We have made some progress and should be reporting out to the public and to to this board fairly soon. And it's not it's not, the goal wasn't to supersede Concom, but to look at what other public benefits could be available and what would work. And we're getting there slowly, but it has not been easy. And I think that's it. Thank you.
Libby?
I just want to follow up on Matt's comment about ACNVT's letter about the noise. We got a lot of noise complaints in a certain area over the summer as well. And you actually, I think, will have that sort of on your agenda next week under a discussion about town meeting warrant articles, that you have a preliminary discussion of 2021 annual town meeting warrant articles scheduled for next week. And I had let people know that they should check the website to see when that is coming up. I told them it would be early October. So I'll try to remember to tell them that, but that's on the list of potential articles.
Yeah, we did talk about this 2 years ago. We did make the one change to the noise bylaw and doing a more complete review and overhaul of this. But I think it's been a little bit dropped to the wayside with COVID. Matt?
And I think the other thing we should talk about, we had an email today asking about, dogs and dogs on beaches. And I think we should have that conversation. It led to some issues out in Nantucket. There was also a couple instances this summer that were fairly frightening with, on beaches with people being pinned by dogs in the water and different things that we received in June or July. And so I think it's something, and so it's unfortunate because, how I look at it is, as we can't just, some of this would be great if we didn't have to talk about it. But if we're going to add, 200 homes a year, 150 homes a year at X amount of people, then things that we used to be able to do before, we've done it to ourselves. We can't do it anymore. And so, it's not, even just dry, so anyway, that I think this is one of those issues that we should talk about and try to get a hold of.
We're getting a little off committee reports. Are there any other committee reports? Okay. Then I will see you all tomorrow morning. Is there a motion to it? Oh,
Sorry, I just wanted to remind everybody that I desperately need you all to stop by individually to the office. We have a lot to sign that requires notarizing, and so please stop by tomorrow. Thanks.
I'll reach out to you tomorrow when I'm near town. Is there a motion to adjourn?
So moved.
Second.
All those in favor by roll call, Melissa Murphy,
Aye.
Christy Ferrantella,
Aye.
Matt Fee,
Aye.
Jason Bridges,
Aye.
Don Holgate, aye. See you tomorrow. Thank you. Bye.